Welcome to the Feeding Hour. In this episode, Abbey with an E, Abbey Gray, opens up about her breastfeeding journey, and Catherine celebrates passing the speech-language pathology PRAXIS exam. Abbey Gray shares a story of feeding her first son and the rewards and challenges with breastfeeding. She talks about her long, unmedicated birth experience and her positive hospital birth, as well as trying to breastfeed her first son, things like low blood sugar and sleepy feeding patterns, which made the experience a little tricky. She opens up with us about her health issues postpartum, and she covers tongue ties and how they influence feeding her son. We're so happy to have Abbey on the episode today, and we hope you enjoy. Hey, Abbey.
Hi, Catherine. How are you?
I'm well. How are you?
Good.
Good.
Congratulations on your passing your exam this morning.
Thank you. To all our listeners, I've passed the PRAXIS.
Woohoo! One
Very
step
exciting.
closer to being a full-blown SLP.
Very true. And speaking of full-blown SLPs, we have our guest today, Abbey Gray.
Yes, she's Abbey Gray. She's from Eat, Speak, Play. She's an SLP and feeding therapist and CLC lactation counselor in Atlanta, and she's a mom of two boys. So we're two boys, right?
Yes.
So we're excited to hear her feeding journeys today.
Yeah. Thank you guys for having me.
Yeah, thanks so much for being on. So,
Yes.
yeah, Abbey Gray, we'd love to start off with just hearing about your personal feeding journeys with your two boys. So, starting with your first child.
Yeah. So my first son, he's going to be 4 in June. His name is Caleb, and so I actually was doing my lactation counselor training while I was pregnant with him, and I took my test. It was like a few days before he ended up being born, because my water broke at 37 weeks, so he came a little bit early. And yeah, so I took the test, and I remember I was being monitored for preeclampsia because I had high blood pressure, and I had to ask for special accommodations for the test because I had to do a urine sample. So, and you're not supposed to go to the bathroom during the test. So that was interesting. And then it was, I had been working as a speech language pathologist at this point. I started in 2014, and I always did feeding therapy. That was like my specialty, because in grad school we had a pediatric feeding course, and I did an internship for that. And then I went on to work at that practice. And so I wanted to add in lactation because I felt like I really enjoyed working with the little babies, and I felt like it was a natural addition to my training. So when COVID hit and everything shut down, everything was kind of virtual, and it was easy for me to go and do all of the training for it. And then he was born, and I found out later that I passed the test. So that was great, and became a lactation counselor. But during my pregnancy, I was very focused on breastfeeding because that was my huge desire. And especially with the training, just learning about all the benefits. And so that kind of guided my desires for labor and delivery too, because I wanted to try to do as unmedicated of a birth as possible, which I did not have an epidural, and I pushed for 6.5 hours.
Oh my gosh.
So that was a lot, but everything worked out great. And we did immediate skin to skin and had golden hour. I think it might have been 2 hours, and he left right away, and everything was great.
And is this, pardon me for interrupting, but we had a doula on last episode, so I'd love to know, was this in a hospital setting, or what was the setting?
Yeah, we were actually living in Maine, which is where I'm from, at the time, and we, but I had been living in Boston prior to COVID, and so my OB was in Boston, and we decided to stay with her and deliver in Boston. So we were traveling like almost 2 hours for my appointments and for the birth, which ended up being fine because my water broke in the middle of the night and there was no traffic. And it was a little nerve wracking because his due date was July 6th. So we were a little bit like, oh, is the 4th of July going to mess with this? But no, so it was with an OBGYN in a hospital setting, and I didn't have a doula because it was COVID and I wasn't sure who could be in the birthing room. So my support came a lot from the nurses at the hospital were incredible. And my husband was just really involved. And so that was really helpful.
Did
Yeah.
he have any training prior to? Like, did he know how much about birth did he know? Yeah.
Yeah, we did like one of the hospital like birthing class online thing, and we didn't make it all the way through it because he came early, and so we were I don't think we finished, like we didn't get to like the breastfeeding part, which was fine, but he actually remembered a lot more from those videos than I did, because like in birth, all these decisions come up that you don't think about or you're not prepared for. And I was like, I don't know what the right answer is. And so I'm like frantically Googling. And this is where I feel like having a doula would have been very helpful, because these things just kept popping up. Like, oh, do you want to do this or this? Or, and I felt like my OB's practice was very good about giving me decision-making abilities and respecting my wishes. Because like I said, I pushed for a very long time and they never really pushed me for like, interventions, or they mentioned once like C-section, and I knew I really wanted to try to not have a C-section. But he was really good. And I mean, our nurse was amazing too. Like she was with us because I think I was in labor for 32 hours.
Wow.
And so we went through a few nurses, but she like stayed later because I was so close to actually birthing him. She was like, I'm going to go do some work, but I'm going to like hang around a little bit longer. And so she was actually there for the birth, which was huge, but a lot of coaching from her. And yeah, my husband was very, very involved. Like we joke now because we had talked about like, oh, are you going to like look down there during the birth? And like, I don't know. And now we joke because we're like, well, you were holding my leg, like
you were very there
for, so many hours.
I always laugh too, because my husband always says how he's like so non-medical. Like he never wants to hear about my patients. He's like, it freaks me out. I don't like hospitals. But then like during the birth, he was like so into it. I'm like, something happens to them. Like they just turn it on or something.
Yeah. It's crazy. And we also have one of his close friends is an OBGYN too. So we were like texting him questions during the birth also. So that was helpful.
Good. Yeah. So then tell us about kind of the golden hour, and like just with that kind of long but mostly smooth birth. And then how did that first latching experience go?
Yeah. So he was, like I said, born at 37 weeks, I think 2 days. And he was very big. He was 8 pounds, 5 ounces. And so he was large for gestational age and had some like blood sugar difficulty. And this is one thing, like looking back, I wish that I had, I don't know, like maybe the hospital had handled differently or I had pushed more for, but they were like initially, let's give him a little bit of formula. And I think formula is great. Me personally, I was trying to do only breast milk. So in the hospital, I felt like it wasn't really that challenging for me because it was kind of like, well, this is what you need to do. And I was like, okay, if that's what they're recommending, like we'll do that. But he did latch before that. I can't even remember like at what point they ended up doing like a little, and it was a very small amount of formula, and then everything leveled out. but yeah, it was, I mean, it's just incredible because, you know, you go through all this pain in labor and delivery, and all of a sudden it just kind of like disappears and you kind of forget about it when you have baby on your chest and baby's there. And just all of the training and videos that I watched about the golden hour and like the baby crawl and to the breast, things like that, it just all seemed to happen. And it was just magical. And yeah, and he was when we left the hospital, he was, I can't remember when it started, but he was always kind of like a sleepy feeder. Like he would always like fall asleep while he was eating, and often feedings would take longer than, you know, what they say, which is like the 30 minutes, 15 minutes each side. Which is arbitrary, but he definitely was feeding for a longer period of time and would often fall asleep. And, you know, I remember talking to our pediatrician about like, how can we keep him awake? Because he just falls asleep so easily. So we tried all the tricks and it just was really difficult. And then, so that was kind of like one, I guess, looking back, like red flag, or like warning sign of maybe there was something else going on.
What were the tricks like that the pediatrician recommended?
Yeah, like undressing down to a diaper, kind of like tickling their feet. He said like putting like ice, like a little bit of ice on his back to like get him to stay up. What were some of the other ones? Like changing position and kind of like, you know, just trying to move him.
It's really hard to feed a sleepy baby, especially any prematurity at all. Like even like 37 weeks, a lot of people would just say is like late term and not too early, but they're just not fully ready. I find like anywhere before 40 weeks, they're just like not quite ready yet.
Yeah. It is really interesting because then my second was born at 39 weeks, and even like those extra 2 weeks, I feel like made such a huge difference.
Exactly. Even though your water broke, so obviously he was ready. He was 8 pounds, you know, but he was still just a little more immature with the.
Yeah. I mean, and I was like ready because, like I said, I had high blood pressure at the end, and I was so swollen. Oh my God, so swollen, and it just was so uncomfortable. So yeah, but then and so he was tracking like for our pediatrician visits. He also, when we got home, had some jaundice. So we had to go into the pediatrician's office. I remember it was like on a weekend where they weren't open. So we had to go to like their, you know, little on-call site or whatever. And they didn't recommend formula. I can't remember. And we didn't have to do the lights or anything like that. So it resolved pretty quickly, which was good. And he was like kind of tracking on his growth curve. He was 99th percentile when he was born, and it did decrease a little bit, but nothing that like anybody was really that concerned about. But then at 5 weeks postpartum, I started having massive pain in my back, and was like, this is getting out of control. Like it was like to the point where I was like just hunched over the toilet, like dry heaving because I was in so much pain. And so I decided that I was going to go to urgent care. And so we went to urgent care, and I didn't, thankfully we had introduced a bottle with Caleb at like 4 weeks. And he took it great. And I don't think I had started pumping yet at that point, but I did use the Haka like on the opposite breast after I had fed on that side. And so I had a little bit of milk in my freezer. And I didn't know how long I was going to be at urgent care. And again, it was COVID. So like you were limited on people you could bring. So I just had my mom come and watch Caleb while I went to urgent care. And I think my husband came with me and just stayed in the car. But we were just trying to figure out like what was going on. And so they ran a bunch of tests and did all the things, and they couldn't figure out what was going on. And I ended up being there for like, I don't know, 8 hours or something at urgent care. And I didn't have Caleb with me, and I didn't have a pump. And like in hindsight, I really wish that I had packed that stuff, because, you know, we were feeding every like 2 hours. And
Yeah.
so like I feel like messed up my supply a little bit. And then they finally figured out that I had a ovarian cyst, and they were like, you know, we're going to send you to the ER because we're going to have to do surgery because it's probably like twisted, and that's why you're having so much pain. And but it was all like unknown, you know, what was going on. So we went to the ER and were there for an extended period of time. And as soon as we got to the hospital, I requested a pump so that I could pump, and pumped a whole bunch. And then we were there for a little while, like waiting to figure out what's going on. And then they came back and they were like, oh, okay, we can take you back to the OR right now. Like it's this, you know, magical time of night where there's nobody there. So let's go. And I was like, oh, okay. And they said, like, we're going to remove the cyst, but depending on the severity of it and how much it's twisted, if it has cut off the blood supply to your ovary could be like dead, and then we'll have to remove that too. But we don't know until we get in there. And so
Was it
really stressful.
Yeah.
Yeah.
Wait,
and so
did they do a sonogram to determine the cyst, or how did
so
they?
they did at urgent care. They did a transvaginal ultrasound, and then they couldn't really see a whole lot for some reason. And then they did, I can't remember, I think it was a CT scan, and that's when they saw like stuff on the imaging. I don't think they did an X-ray, but now I can't remember if they did or not.
That's so much to go through though, like 5 weeks postpartum. Like,
Yeah.
I just, because even leaving your baby at all at that point feels so stressful. And then to have everything so unknown, and then like, oh, now I have to figure out pumping, like when I've never really pumped before.
Right.
And how was the hospital pump? Because
it was fine. I'm trying to, like, you know, obviously they didn't have like the right size flanges, I'm sure, for my nipples. So I'm sure that was not ideal. And, you know, it was one of the Medela
Symphony.
Yeah. So it was like one of the big roll around ones. And I remember like I had to request them to put it in a fridge and like them handle the, you know, the breast milk was kind of like stressful too, and just trusting that it was going to be okay. And then I had to like organize one of my family members coming to get the milk to bring it back. And like, you know, because I was going under, I wear contacts, and I'm very blind without them. So I had to have like somebody come and bring me my glasses so that I would be able to see. And it just was a mess. And thank God our family, my mom and my dad and my younger brother all live near where we lived in Maine. So they were able to come and help out because we were gone for such a long period of time. And thankfully my husband could be with me during the like pre-op and all that. But yeah, it was kind of like this unknown of, you know, and I remember calling my mom, who I think was with Caleb at the time, and just like crying, being like, tell him I love him, and, you know, I'll see him soon, hopefully. Like it just, you know, was really difficult to know, you know, and I knew that I wasn't in like, you know, life or death danger, but it just felt scary. And like anytime you go into surgery. And so they did it laparoscopically. And so I had 3 incisions, and like 1 in my belly button and 2 on either side of like that area. And I remember waking up from surgery and just feeling so terrible. Like I think my body has a really hard time with any sort of pain medication or sedative, or, you know, the general anesthesia. And I just was so sick, and I couldn't see anything because I think at that point I didn't have my glasses, even though they got dropped off. My husband couldn't bring them to me. So I was just very disoriented. And I remember asking the nurse, like, oh, did they have to remove my ovary, or was it just the cyst? And she was like, oh, let me look. And she like typed in the information, and she was like, oh no, it looks like they just had to take the cyst. And I was like, oh, that's great. And so that was exciting in the moment. And then it was like, it's supposed to be like an outpatient, I guess, surgery, not outpatient, but like it's supposed to stay overnight. Like they do it and then you leave. And so they were like, as soon as you can keep down food or something and don't feel nauseous, then we can discharge you. So I was feeling very nauseous, but I think it was only a few hours. And then they wheeled me out to my husband, who was waiting with the car. And I just was in so much pain, like in my abdomen. And I remember telling my husband, like, oh, that's great that they didn't have to remove the ovary. And he was like, no, they did. They had to take out the ovary. And so
why would they not tell you the right information?
I think the nurse just misread my chart or something. So that was a little like, oh my gosh, okay. And so they had to take out my left ovary and fallopian tube. But they had kind of prepped me ahead of time saying like, this shouldn't impact your fertility moving forward. Yeah. Because the other one like takes over for both of them. And so
that's amazing for anyone who, like, I have some personal connections that have one ovary, and I'm like, oh, that's like such a positive story to know that you had a second child after this.
Yeah, for sure. So, but that was scary because I was like, I don't know what that means and all that stuff. So, and then the recovery was just so rough because I was just in so much pain, and I didn't want to take any of the like prescription pain medications because of breastfeeding. And, they kept assuring me like, it's okay to take it. But I was like very adamant about like, I'm only going to stick to Tylenol and ibuprofen rotating through. But it was painful. I mean, it honestly felt like I had a C-section after I had a vaginal birth. And so it was really hard to get into like the right breastfeeding positions and get comfortable with that. And then also I think my supply just kind of like really took a hit from, going an extended time without pumping, and also the trauma to my body.
Yeah, to your body.
Yeah. Stress. So that was really difficult afterwards. And I just remember really struggling with breastfeeding after the surgery, and overall just like my mental health really took a hit too. And then we went to his 2-month visit. I think that's like the next one in between, because there's like an extended period of time where you don't go, and it's, kind of frustrating. But I can't remember if he had lost half an ounce or he had only gained half an ounce, but either way, it was like concerning because they're supposed to be gaining quite a bit by that age each day. And so he had like completely dropped off, like went like below first percentile for his weight. And I just felt like so incredibly guilty. Like, oh my God, how did I not know? And like, because he didn't look totally like tiny, and he was meeting all of his developmental milestones and seemed happy and all that stuff. And so it was like, oh my God, just so terrible. And my doctor was like, like you should go see a lactation. He didn't jump. I mean, he did say like, you should maybe try formula, but I did tell him like, I really don't want to do formula. So like, can you tell me what my other options are? And so that's when he was like, you could go see lactation. And I can't remember if the pediatrician recommended triple feeding or if we went to see lactation and then they recommended it. But anyway, that took us down a route of like going to see lactation and doing triple feeding and exclusively pumping to try to get my supply back up. And it just was, oh my God, so taxing on top of everything else. And we ended up using donor milk because I felt like I wanted to stick with breast milk. And we got it through the hospital there that I had my surgery at. And that was the other thing. Like I didn't have an OB up in Maine. And so Right. So the OB that did my surgery, I really, really liked her, and I ended up like sticking with her for a little while. And yeah, so that was, man, a lot. And I like ended up renting a hospital
Grade pump.
company pump, which ended up I didn't really use that much because I felt like my Spectra, I did better with my Spectra. And yeah, go ahead.
Yeah, just two things from that. Could we go in a little bit on triple feeding? I think we've mentioned it in previous episodes, but like both of y'all,
Yeah.
CLC and IPCLC, could you both contribute to what is triple feeding?
Yeah.
You can go first, Abby.
Yeah. So it's supposed to be a very, very short term like recommendation or solution for when you're having breastfeeding difficulty and trying to figure out, I think, well, yes. So basically triple feeding is you are topping off your baby with pumped or expressed breast milk. So you breastfeed them and then you pump and give them a bottle. And so you're trying to get more, you're trying to continue the breastfeeding journey so that your baby is used to continuing nursing. But it's if your baby needs to be supplemented with a little bit more, then you pump afterwards and give them a bottle of that pumped milk.
And it's a lot of times if you're your baby's not transferring enough at the breast for whatever reason, and then you need to give them more from a bottle, but you want to keep nursing, and you don't want to just give them a bottle and nurse, because then that would tell your body to like not make as much milk. So that's that's why we would ever recommend this, is because if it would be great if we could say, hey, just nurse and then give the bottle. But if you just do that, which plenty of people do, then your supply does decline over time. So the point of the triple feeding is to keep your supply, or at least increase or try to maintain it. And so, but it is really, like Abby said, like we want it to be temporary because it's so challenging time-wise. So you really need a lot of support to do it. And also like, I mean, professionally, I always try to recommend, if someone's doing that, then at least at night, pump and bottle, go back to bed. Like, I think that's a common recommendation now, but at the time when I was doing it, which was around the same time, I was doing it every single feeding, which is just insane.
Yeah. And it was really challenging because at this point, my husband was, back to work. And although he was working from home, it was still like, okay, I'm trying to pump and also bottle feed my baby. Like that was the hardest part for me, was like, how do I pump? And because, I was using like not a wearable pump, which they wouldn't have recommended, or I wouldn't have done anyway, because it's just not as good or effective. But like, it is really hard to like physically feed your baby. And so that was exhausting.
Mentally taxing, like you said. It just makes you feel like your whole life is feeding, when like you're trying to bond with your baby and like take a shower, like do other normal things.
Yeah, recover from surgery.
Yeah,
right, exactly.
And then another thing about the pain medication and surgery, I'm curious if we could get into for a few minutes what kind of that, like, what is the filter between what the mom takes and then what the baby receives in terms of medication, supplements, etc.?
Yeah, it depends on the medication, and there's like a whole database where they have all the information about what you can take and what is recommended, and there's different like classes of medications that are better for baby. It's multifold, because there's also like it crossing so that it goes into baby versus it affecting your supply too. So there's certain medications that can decrease your supply also. I can't remember which pain medication they prescribed me, but it was probably some sort of oxy, pain med. And for me, I remember calling the nurses line at the hospital and them saying like, it's totally fine for you to take, because this is often what we prescribe, or this is what we prescribe C-section mamas. So like, and they nurse afterwards too. And I think I mentioned before with my surgery, like I feel like I have a hard time with pain meds in general. And like, to be honest, I was super constipated after giving birth to Caleb. And I knew that it would make it, the pain meds would make it worse. Cause I had like, I had taken them once in the past for like, I broke my leg or something. And I remember just the constipation was terrible. And I was like, I don't want to add that on top of
another problem.
Constipation.
Oh gosh.
Yeah. So it really just depends on the medication and like how it reacts to your body and how it transfers through your milk.
So how did you kind of move forward after all of this, after the recovery, the triple feeding, the weight loss, like for him, or just slow weight gain, we should say for him. Did you guys feel like you got on a better groove after that?
Well, so then after the triple feeding, we decided that I was going to exclusively pump because we wanted to increase my supply and also just know like how much my body was producing, which is a tricky balance too, as I'm sure you know, Abby, because like often your body doesn't respond as well to the pump if your baby is feeding, adequately. But that was also really challenging because, oh my God, exclusively pumping is not for me. I know a lot of moms do it either by choice or, because they feel like, because they have to, but it's just, again, an exhausting thing to have to do all the time. And so I did that for about a month, and I remember our pediatrician and our lactation consultant often would like disagree about amounts that he needed to have in a day because, I love pediatricians. I think that they're great. They're just not totally specialized in lactation like a lactation consultant is. So I was always like, let's look at the numbers that the lactation consultant is giving us versus the pediatrician, because the numbers he was giving us was like, oh my God, my supply is never going to get to that.
Never going to match it. Also, I must say, because he started out so high on the curve, I'm sure that was working against you. Like that he started out 99th.
Sure.
Then they're like, give him all this needs to grow. So what?
Yes, exactly. And like, I think that kind of got lost in everything too, the whole large for gestational age, because often those babies will lose a lot more. And so that was, and I remember
you know what his curve, you had no idea because you were at both ends of the spectrum. You had no idea what his normal curve would have been.
Exactly. And, I remember like me and my husband, kind of like my husband wanting to do the amounts that the pediatrician was saying and me being like, well, the lactation consultant is really the one who knows better. And so that was challenging too, because we were supplementing with donor milk, which was, oh my God, such a godsend, but also expensive and like not easy to come by. And I remember at one point before we got the donor milk, my mom was over and my husband and I was like just really struggling with feeding Caleb, and they were like, let's just give formula, because we had some of the like pre-made I think Similac from the hospital that they had given him when we were there. And I was like had a breakdown about it, but we ended up giving him like, a little bit of that, and I just lost it. But then after that we just did donor milk, so the donor milk that we got was like not peer-to-peer, it was through the hospital, so it's like pasteurized and vetted and all that stuff. It's because I know sometimes people are like unsure about donor milk, but we felt good about using it.
We felt good about it. Yeah. Just I don't know if I should say this, but I've done it peer-to-peer before, and it's just to your comfort level. I think like, I know, because it's just like you said, it's expensive and hard to get. But I feel like I felt comfortable because I would like meet the mom that was giving it to me, and I was like, right, she clearly is like pumping this for her own kid and just has extra. Like, I felt like I could trust that she wasn't doing anything bad. But
weird with it. Peer is like you get the milk from a mom friend,
like on a Facebook group, or like or a mom friend or whatever. Yeah.
I mean, think about it.
I would have done that, but like, again,
you're a first mom, you're like, what am I don't want to just give my baby this random. I used to joke that
mom friends, like,
Yeah.
to like share milk with. And
I used to joke around
Historically,
that my
like wet
husband,
nurses.
yeah. Oh yeah. What? Yeah. Well, I used to joke around that my son had, probably had like the best antibodies ever because he'd had so many different people.
yeah,
Crazy.
yeah.
Anyways,
That's
but keep going. Keep
yeah,
going.
yeah.
Yeah, no, I mean, in hindsight, I feel like I would totally do peer-to-peer now. But also it was COVID, and I think that
Yes.
adds another factor into it too, because it was like, oh, is it vaccinated or not vaccinated? Have you had COVID? Like blah, blah, blah. So
Totally. Yeah.
that complicated things too. But yeah, so then it just like we would do weighted feeds every time we would go to the lactation consultant, and it was so stressful because it was like, oh, he's not transferring a lot, like something else is going on. And I had also during the COVID shutdown, and I think during pregnancy, started some myofunctional training too. And so I was like engulfed in the world of tethered oral ties, like tongue ties, lip ties, things like that. And I was like, I really think that he might have a tongue tie, and like that's something that's contributing into it. And my doctor, the pediatrician that we had up in Maine, he actually was my pediatrician. So like he's very old school. And I'm sure that you guys have experienced this where pediatricians, they're kind of like often in a camp of like tongue ties don't exist or they don't impact feeding and like whatever. And so he was kind of that mindset. But and the lactation consultant that I was seeing at the hospital was like, let's just rule everything else out and then we'll talk about that. And then I don't know who I got a recommendation for a different lactation consultant at a different hospital, but I went to see her and she was like, oh my God, an angel on earth, like the most incredible woman. And was like, the other lactation consultant was very helpful too. And like, she was very more structured. And this lactation consultant was like, let's look at your mental health and like really, yeah, like take a step back. And she was like, I'm going to look in his mouth and do some assessments. And she was like, I do think that he has a tongue tie that could be impacting. So like, I'm going to refer you to this dentist and you go and just get an opinion from him and see what he thinks. And I remember calling my pediatrician's office and they were like, and asking for a referral, even though I don't think I needed one for my insurance, but it just felt like I needed to let them know. And I remember them calling me back being like, oh yeah, the doctor said that he'll write you the referral, but like if you go to that dentist, they're going to say that he has a tongue tie and want to do the surgery. And I was like, well, I mean, yeah, if he's the expert, if he's the one that does the tongue tie release,
everyone who's being referred to him probably does have one because
like that's how that works. And so luckily that didn't like deter me from going. And I went and they were like, yeah, he definitely has a tongue tie and he has like a mild lip tie, but we think that like he's compensating for that. So we don't think you need to release the lip, but let's do the tongue. And at this point he was 3 months old. So we got him pretty quickly and they did the release and it wasn't like immediate, like, oh, we nursed him right there in the office and it was all of a sudden like everything was fixed. But it did, like after a couple of weeks, it was such a huge difference with him nursing. And like, oh my gosh, like at this point I had gotten my supply like almost to where he was, what he was eating in a day. And so then we got back to nursing and he wasn't like as falling asleep at the breast and
amazing.
His feeds weren't taking as long and he was transferring more. And then he got back on his growth curve and it was just night and day.
Oh, I have a follow-up about this because I feel like working with moms with these type of journeys and my own, I'm like, how did you do with like the mental health piece of going from like knowing what he was eating and being worried about weight gain and worried about transfer to being like, I trust my body. I know that he's getting enough. Like, did you have a hard time making that shift?
Oh yeah. Oh my God. It was really hard. It is really, really hard to go from exclusive pumping back to nursing and trusting like, oh, he's getting what he needs, especially when his feeding had been like dysfunctional up to that point. And then just being like, okay, we're going to trust that he's transferring what he needs to. Cause I don't have like a
scale that
show me. Yeah. And I think at one point, one of the lactation consultants was like, you could rent a scale from us, but like, I wouldn't really recommend it because I think it's going to really like not be helpful for you and your mental health. Cause I would have been crazy.
It made me a psycho. I did that and it made me crazy.
Yeah, I would have been doing weighted feeds every single time.
Yep.
So yeah, but it definitely was really challenging. And I think we did keep the bottles in rotation because he did so well with bottles, and I would like pump, occasionally. And he also then got to a point where like he wouldn't ever fall asleep without feeding. And so if I needed him to fall asleep, I would just have to like either breastfeed him or give him a bottle. So if we were like on the go, I'd be like giving him a bottle so that he would fall asleep. And
Yeah.
so that definitely was really challenging to go from knowing how much he was getting and how much I was producing to just then trusting.
Did you just kind of tell yourself like, okay, I know he's gaining now? Like, was it like just mantras and telling yourself he's fine?
Yeah. But it was really challenging. And then with my second, I definitely had some PTSD around the whole feeding situation because I was like really nervous that I was gonna miss that he was falling off of his curve, or something was going wrong and I just didn't see it or something like that. But thankfully we didn't really have that issue with him. So that's my story with my first.
Thank you for sharing it and everything about your own personal hospital journey and everything. I feel like a lot of people, I mean, I do hear that sometimes of like either if they have to go back for like a medical issue after birth, or I mean, that can really throw a wrench in a feeding journey. So I'm glad that you were able to get back on track.
Yeah.
All the turns.
I was still working for another private practice, not my own at this point. I had opened my own at this point, but I was on maternity leave, and then I was employed through Massachusetts. So luckily they had FMLA at that point for birth. And then I got extended leave from the surgery, like short-term disability. So I was fortunate enough to go back to work during this period of time, because that would have just been even more difficult, because I was doing like telehealth speech therapy and was like back to back sessions, and that just would have been so hard to do. And then I ended up leaving that job completely after all of my medical leave ended, and then just focused on my own private practice at that point. But yeah, it definitely made me, I feel like, a much more compassionate therapist too, because I was like, man, you can really go through it. And like breastfeeding, like the trainings are great, but like actually being in it and experiencing the mental health piece of it and just balancing all of that stuff, it just really changed my perspective on everything. So that was, I mean, although I wouldn't have wanted to go through it, I do feel like it just added to my professional practice and knowledge.
Yeah. Wow, that's amazing. Yeah. And we've heard from other moms like that, the experience of the baby falling off the growth curve, and then all of the emotions that surround it. Should have done something different. So yeah, again, thank you so much for sharing with us. And we'd love to have you back on to share any story about your second baby too. But the first one was so rich that I feel like we gave our listeners a lot. So thank you so much. Yeah. We always close with a question. What would you tell a new mom who's struggling with feeding?
I would tell a new mom who's struggling with feeding to give yourself grace and really try to, even though it's very difficult, try to consider yourself and your mental health and your load in the decisions that you're making. Because, if you are really struggling and you're just doing everything that you think that you should or need to help your baby, but you're forgetting about yourself, then it's really going to be hard to continue with that journey and not burn out completely. And at the end of the day, you matter and your mental health matters. And what your baby needs the most is a happy, involved, part of the process mother. So looking back, I wish I could tell myself that too. Like, it's okay to give formula, if that's what you need to do in the moment. And, I was very grateful for the fact that I would have donor milk, because that kind of gave me a good middle ground for being able to supplement for my baby, but also providing the breast milk that I had so desperately wanted to be able to provide. But really considering yourself in the process and keeping tabs on your mental health and your load and what you can handle.
Oh, love that.
Yeah. Well, thank you so much. Is there anything you'd like to share with our listeners, like where they can find you, or any projects you have coming up?
Yeah, thank you. I do want to add on to that too, is like finding support, finding good support, because I do feel like having the support from the lactation consultants, even though I had training in being a lactation and feeding professional, when you can't be your own patient, like, you don't know, like, it's just nice to have extra support out there, somebody who understands and can guide you. And I think finding a good match for yourself is great too. So that being said, I also support moms in this journey, and, have dealt with a lot of things personally, but also professionally. And I am launching a prenatal, it's actually a breastfeeding course for both prenatal and early postpartum moms that will be virtual and on demand. So you can always come back to it whenever you need. And it gives you kind of like the whole rundown on the basics of breastfeeding to get you started off, and then troubleshooting for, those times in the middle of the night where you're like, what am I doing? And I do in-home visits within a certain radius of my home in Brookhaven to help moms. And my kind of specialty areas from birth through like early preschool age, but my real passion is breastfeeding and starting solids. So I also teach a starting solids course that's online. I teach it in an on-demand format on my website, so it's always available, and a live format monthly. So those are kind of like my resources that are out there, and I'm always here for individualized support for breastfeeding, starting solids, all of that good stuff too.
Awesome. And we will link your website in the show notes and your Instagram too. So
perfect.
Thank you so much for being on, Abby.
Yeah,
I'm looking forward to collaborating in the future with patients. I'm definitely going to send people your way if they live. I feel like we are very similar in our personal and professional experiences.
Yeah. It's so great to talk to you guys and just kind of share my story. And thank you so much for having me on. I really appreciate it.
Yes, we'll definitely have to come back because I want to hear your second journey.
Yeah, for sure. Alrighty.
Bye.
Thank you guys so much for listening. If you are interested in learning more about attachment feeding or have any feedback for us at all, please email us at thefeedinghourpodcast@gmail.com. You can also sign up for our email list in the link in the show notes to be the first to know when a new episode is released. See you next time, and happy feeding.